Universal health care, caring for Minnesota. No society can legitimately call itself civilized if a sick person is denied medical aid because of a lack of means. Aneurin Bevan. He saw the struggling masses in Britain and had to act. He could not stay with the status quo, even if he was the black sheep by doing so. In post-war Britain, amidst the rationing, people were starving and suffering. In 1946, he sought and received permission from the Crown to try to implement radical change in the British healthcare system. People were starving and poorly everywhere. He saw misery and saw that people couldn't afford to go to the doctor. It took 2 years of negotiating with doctors, nurses, and hospital administrators, as well as drug companies, to get them to lower their prices and join his new healthcare plan that would cover every British citizen from cradle to grave. It wasn't enough to have medical insurance. In his foresight, he saw that for-profit medical insurance like we have in the US would lead to healthcare inequalities. He designed a system that would cover every citizen, with every able-bodied person contributing to the National Health Service, or NHS, through their employment. Their taxes would cover everyone regardless of their ability to pay or not. In the United States, people are still suffering. The rising trajectory in the inability to pay for health care is a disturbing trend that is likely to continue and even accelerate, said Tim Lash, president of West Health Policy Center. Approximately 91 million people are unable to afford quality care, according to the West Health Gallup Healthcare Affordability Index. The rate for Black and Hispanic Americans is significantly higher, at 46 and 52%. There is good news. Minnesota has close to universal health care as you can get under the current health care model. With expanded medical benefits and affordable health care options, we have the lowest rate of health care insecurity in the country. I believe this country needs a change. Like Aneurin Bevan did in his native Britain in the 1940s, I believe that our current model of for-profit healthcare needs to change. We cannot live with our heads buried in the sand, blind to the suffering of our fellow Americans. But until we can pass laws creating the lasting change which guarantees all Americans fair and equal access to health care, Minnesotans can do something. If you or someone you know is currently without health care benefits, visit www.bridgetobenefits.org to find out how you or your loved ones and friends can receive access to affordable options for health care.